Go. Okay, so I want to welcome Patrick Riecke. Patrick is the Director of Chaplaincy and Volunteers at Parkview Health Network. He's also an ordained minister, and he's here to talk with us today about grief, loss, and pastoral care during COVID-19. So Patrick, thanks so much for being here, and take it away.
Well, thanks so much, Matt, and thank you to the Center for making today possible. Excited to be with you. It's something I've looked forward to all week. We think have an up and down week. I'm sure you can associate with that, but this has been something I've been looking forward to. Just to make sure that technology is working okay, you should be seeing my face and hearing me, and you should be seeing a slide that kind of gives my title and an introduction. If you would put a Y in the chat, if you're seeing and hearing what I hope you're seeing and hearing, okay? Seeing lots of Ys, good. If you have any technology problems, as Matt said, use that Q&A part. It looks like most of you are seeing and hearing just fine so far, so that's what we want. We're happy about that. But if you do have any problems at any point, use that Q&A function to work with Unita, and she will help you make sure things are going smoothly. Thank you, Nancy. Thank you. Good to see you again as well. Well, I'm not seeing you, but good to have you here again, Glenda. So we're going to start off right off the bat with a poll. We're going to be using a lot of polls and using the chat a lot, so thank you for finding that early. So Matt, if we can go ahead and throw that first poll up, we're going to start off by having a little bit of fun, and then we'll get a little bit more serious. So the first poll today is to ask you to review the year that you've experienced so far. So some of you, okay, there's a lot of greeting of other people here. I feel like we're one big happy family. We're getting together. I'm seeing hellos across from one attendee to another, which is pretty great. So if you've ever reviewed a product, this will be a little bit similar to that. If you had to review 2020, how likely are you to recommend this year to others? Are you highly likely, somewhat likely, neutral, unlikely, or highly unlikely? So if you're reviewing this as something you purchased on Amazon, or a book that you've read, or a product that you've used, or a service that you've used, maybe you've done a 5-star system like this before, so think of it in that way, with a highly likely being 5 stars, that you give the year 5 stars so far, or all the way down to just the 1 star. So as those come in, Matt's going to share those results with us. I suspect that we'll see a spectrum here where people have different feelings about whether or not they would recommend the year that we've had so far. Certainly been an interesting year. At the very least, we can agree on that. So 0 of you would be highly likely to recommend the year 2020. I can appreciate that. Our winner is very unlikely, and some people that would recommend the year probably experience some growth during this time, and then a lot of you are unlikely. I would put myself so far in the very unlikely category. I'll tell you a little bit in just a moment about what it's been like to be a healthcare leader, and a healthcare leader with a spiritual focus, and a team that has a spiritual focus during this time. But also personally, and I'll share it, I haven't shared this at the other webinar, so I'm going to share a little bit of a personal experience before we go any further. My son is a senior in high school. And so at the end of last year, we all felt so badly for the seniors who are missing the end of their sports seasons, or their school year, or their prom, graduation ceremonies, even lots of different pieces that they were missing. And we felt so much compassion. And I can't tell you how many times I said, I'm so glad that Damien's not a senior yet. Well, now here we are, and it is his senior year. And certainly the pandemic is not over. The effects of the pandemic certainly are not over. He is starting for his first time on his varsity football team for Carroll High School here in Fort Wayne. And he's all football. He has loved football since the moment he understood what football was. And his first football game last Friday night, no fans were permitted. So I think I've missed one other football game since he was 3 years old. He's about to turn 18. And this was the second one, and I'll miss again tomorrow night. First home game, no fans permitted, and so we'll be missing those games. So that is not the most significant thing. That is not the most significant loss of the pandemic, but that's a little bit of where we're at today. My daughter actually is here at home with us today. She has a fever, and so even if you don't have coronavirus right now at school and you've got a fever, you're out of school for a while. So those things, and then some of the experience I've had at the hospital, would probably drive me towards that very unlikely to recommend 2020 to others. All right, we're going to put up another poll, a little bit of a more serious nature, and getting a little bit more at the heart of what we're going to be talking about today. So Matt, if you'll throw up that second poll for us, we'll let our attendees respond. if you had to measure your spiritual health and whether it's improved or worsened, and I'm thinking especially that 6-month time frame from January, before coronavirus really had an impact here in our area, to July, as we're coming out of quarantine and some things were starting to reopen. Would you say that for yourself, and you use whatever description you want to use, your spiritual health, your vitality, however you would describe it, would you say that it has worsened, that it has improved, held ups and downs? Where would you measure that? So I'll give you just a minute, take a sip of my coffee here to respond, and then click submit when you've got that response for yourself. So we do have some people saying that their spiritual health has improved, and a lot of you saying has held ups and downs. I think probably all of us could check the held ups and downs about any year, but certainly this year has felt as though it's had a few more ups and downs than usual. So I want us to think about that a little bit as we move forward into thinking about what life's been like for me as a healthcare leader and a spiritual leader, and then think about our congregations and what people have been experiencing. So I get back to my slide deck here. Let me tell you a little bit about what it's been like to be a chaplaincy director at a large health system, Parkview Health in Northeast Indiana, Northwest Ohio. The pace, I think there's been a wide variety of what people have experienced, right? Some people have experienced a total slowdown of things that they would normally do. For healthcare, of course, we experienced a huge increase in the pace of how much was changing, how we had to adjust, how we had to respond, what we had to do. Probably for about 6 weeks, I worked certainly 7 days a week, and most of those days, 10, 12 hours a day, calls in the middle of the night, all sorts of things going on. So the pace for me, I've been in ministry for over 20 years, and I've had lots of quick paced, heavy times. This was the highest pace, the most demand that I've ever had occupationally. And then that fear and that worry, that anxiety that we feel, that's felt in our community as a whole during this time, certainly amplified in the hospital. Let me tell you a little bit about what we do. And you may see the phrase RHCs on here, the acronym RHCs. So Parkview chaplains, we respond to what we call RHCs, and that's an acronym that we use, stands for respirations have ceased. So an RHC is a death. Parkview chaplains respond to every death at Parkview, any Parkview hospital. So community hospitals, our large Parkview Regional Medical Center campus, which is enormous. Parkview Randalia, which is our initial main hospital, which is a large hospital in downtown Fort Wayne. We respond to those 24 hours a day at the time of death, 365 days a year. Whether that death is a 106-year-old grandmother in a hospice bed, or whether that death is a young mother who's miscarrying at 6 weeks pregnant. So we average, and I have to always slow down when I say this because it's heavy for me, we average responding to 5 deaths every day. So that has been affected by this time. Our numbers of deaths have gone up during this time. Even though sometimes our occupancy of the hospital had gone down because people weren't having things like knee replacement surgery or things that they could put off, possibly put off. But even though our occupancy level was down, our death numbers were certainly up. And so I've been one of a few people at Parkview that has kept track of every death, certainly every death period, but especially every death surrounding COVID. So that has been heavy. In July, so the month that we just concluded not too long ago, in the month of July, we responded to more deaths than we ever have before as a department, and certainly exceeded that 5 everyday average during that month. That's heavy for anybody, and it's been heavy for our team. Next, I also lead our ethics committee. And so even just paying attention somewhat, even if you're not in healthcare, you can anticipate that the ethics side of things during a pandemic has been really complicated and convoluted and had a lot of importance placed on that. And we're going to talk a little bit more about that later. And then, of course, we've all made so many changes and adjustments. And in healthcare, I don't know if we've made more adjustments than anybody, but certainly we're near the top of that list. So lots of adjustments on a daily basis. So we took that poll already. Thank you for that. I'm going to take a little bit of a pause here to let you respond in the chat about what you're hoping we'll discuss today. Hopefully you read through the description, you have a general sense of what we're going to talk about, but I like to ask this at the beginning so I have a sense of what's in the room, this time in this virtual room. So what are you hoping that we'll discuss today? Just type that into the chat, submit that for us, not in the Q&A this time, but in the chat, and let us see. I'd like to see a few of these before we go on. We'll put up this list to kind of prime your brains a little bit as you're typing those in. Here's some things, some titles of upcoming slides. How do we help or assist congregations? I'm going to open my larger chat on my desktop here so I can read anything that's longer than a few sentences. Just a second, get my PowerPoint slides back up here. Not following Matt's instructions here to use my keyboard to get to the right place. So there we go, now I can see you. Okay, care for local pastors, facilitate emotional healing. Oh, we got a hospice chaplain, Julie. A lot of respect for what you're doing. Glenda, my first post-COVID funeral, difficult to minister. Special griefs, yeah, we're going to talk about special griefs here in just a little bit. Tools to be able to give others as they navigate grief, and we're going to talk a little bit about that. How to help others cope with isolation. We're not going to talk too much about coping, but we are going to talk about the topic of isolation a little bit. Helping to listen to others, bring words of comfort, good. How many chaplains are on staff at Parkview? We have right now, I think 20. We're down a little bit. We do have a hiring freeze, unfortunately, right now. But we're blessed to have 20 chaplains. Mix of full-time, part-time, all professional paid chaplains. That's my little Parkview chaplaincy commercial. I'll end that now. Caring for parishioners when you can't physically be there. Absolutely. I think that's one of the things top of mind for a lot of us. So thank you for sharing that. Okay, so here's a few things we're going to talk about, that Job and the layers that he went through. We're going to talk about fear and anxiety, healthcare in the hospitals, funerals and memorial services, and on down the list here. So next question, this is a real question that I want you to put an answer into the chat. What made Job's what made Job's experience so difficult? And I'm going to get my slides back up here for you. Hopefully those will be coming back up. All right, let me know, somebody, if you can see the slide now that says, Job, what made Job's experience so difficult? Thank you. All right, so now some answers to that. Isolation, yeah. His friends' lame efforts, Laura. He was alone, yeah, very much alone. What else? What made Job's experience so difficult? Friends, lousy responses, Michelle says, yeah. So we know Job's experience is one of that God permitted it, yeah. That sense, and Job even says that he was accepting this as coming from God. His perspective being different, confusion, undeserved, yeah. The feeling that sense of this is unjust, right? He did nothing to deserve it was part of what was so difficult. Yeah, good. Okay, so I want to talk about the layers a little bit, and so I think my response is similar to a lot of yours. Job, it wasn't just one thing, it was a lot of things, right? So his business, his animals, remember his farming, everything that he had built up as far as a business, all was destroyed. And then friends, I guarantee that Job had friends that worked alongside him in the fields and with the animals. So he had coworkers, people that he cared about that were killed. And then last, and certainly maybe the most difficult, all of his children in one moment were all gone. And so there's these layers, you know, of when we experience one loss, sometimes we find strength by turning to something else that we haven't lost. It's still a blessing in our lives, right? Well, Job experienced so many things happening and being painful at the same time. And then, as many of you said, it came out of nowhere, unexpected. He was living a good life. He was a good person. And so this came sort of out of nowhere. So right now, everyone in our community has some layers already. And this is why things feel different. This is why so many of you have logged on to a webinar like this, is because things are different. We have layers that we're dealing with all the time. And so I want you to look down this list. Pretty straightforward of things that we're dealing with. Everyone has at least one or two of these things going on in their lives. That fear of getting sick, being isolated, some of the societal racial tensions. Matt and Unita and I were discussing that before we got on today, and obviously that has ramped back up again this week, or the attention, I should say, of that has ramped back up this week. Certainly it's something that we always face. And then the disruption of my work, maybe my income, and then school. I could tell you having kids home for remote learning was not a situation we'd like to repeat, although we never know, it might come back around again. And then changes in family dynamics, and of course, if anyone died in your family during this time. So what I'd like for you to do, there are 7 items here on this list, if I can count. Yep, there's 7. I am, after all, a pastor. Counting's not my strong suit. I like to round up like most pastors. Look at this list of 7 and put a number in the chat of how many you personally, how many of these things are you personally facing in your life right now, or have you faced since maybe March or so? So a number from 0 to 7. How many of these things for you personally have you been experiencing? Julia says 5. Julia says 6, 3. Yeah, 3, 4, 5, 3, 4, 4. No zeros so far. Lots of 3s, 4s, 5s, some 6s, 4. So you see, as we all have these layers going on, in what we used to call normal life that is gone forever. We're not going back to normal, I don't think, at any point in time. But what we used to call normal, we might have 1 of these at a time. Maybe in a really rough patch we had 2. But right now, you know, everyone on this live online right now is experiencing multiple of these, and that's the case for everybody. You know, I've in conversation with people, many people have said they're facing all 7 of these. Well, when you're facing all of those layers and then you dump out something else on top of it, Job is, the experience of being like Job is nearer to us than it's ever been before. And that is heavy and it's hard. It's what all of our people are facing. All right, Job's friends. Were Job's friends helpful? Put a Y or an N in the chat. Were Job's friends helpful? After all, this is why, part of why we're here. We're trying to be helpful friends to people who are experiencing layers of grief and difficulty and struggle. Yes and no. Lots of N's for no. Yeah, thank you, Paula. No. Joan. Nope. They tried. We're being generous. They tried. Yeah, okay. So I thank you for falling for my trick question, because I'm actually going to suggest that they were helpful at first. Now I know what you're thinking of is after 5 verses in, and then they talk for chapters and chapters after that. And during that time, they weren't helpful. But we overlook sometimes what they did right away. And I actually think, so thank you for falling for my trick question. It makes me feel gratified, you know, that you fell for it. So we're going to talk about just those little individual 5 verses of what they did at the very beginning. First thing they did was they heard about what happened, right? And how did they respond? When they heard what happened, they responded by getting together, the 3 of them, Bildad, Eliphaz, and Zophar. So those might not be good names for children. If you have any expecting mothers in your congregation. I'm not sure I would recommend those. Maybe decent names for pets. Zophar sounds like good for maybe a goldfish or something like that. Eliphaz, Bildad, and Zophar came together. We can already learn from them. They heard what had happened. They came together with other friends of Job, and they made a plan. It says they decided together that they would go and sympathize with Job. So the three friends came together and they made a plan. I think we missed this. Okay, we're already learning from them, because this is a part that honestly we miss today in the United States of America. We miss let's get some people together. Let's develop a plan for how we're going to help this person and support this person. We get so sympathetic, right? We have all these feelings of, oh my gosh, I can't believe this happened. That's so sad. And maybe we'll talk with somebody about how awful it is and how sad it is. When what we could be doing is getting together with other people like Job's friends did in the beginning and say, this is what we're going to do. So I want to give you an example of a time I was successful at this, because it would not be helpful to me and my ego to tell you about a time that I was totally unsuccessful at this. So I could tell you about an interesting little time where we were successful at this. In a little church that I pastored about 10 years ago, we had a family who discovered that they were naturally expecting triplets. Now, they had a toddler at home, barely a toddler, really just out of the baby phase. They had a toddler at home, and now they're going to have triplets. And so they needed a community to come around them and make a plan, right? So we scheduled out who was bringing meals when, we scheduled out who was going to come and sit with the toddler when, who was going to pick the toddler up, who was going to help Samantha get to the doctor when she had doctor's appointments. We made this, and this plan had spreadsheets, it had online systems and everything. This is something that we can do. We have tools available to us to come together and to make a plan, and that's what Job's three friends did at first. Second of all, we can't overlook this. They went. I have heard stories of pastors who come to our hospital to make a hospital visit, and because of the fear of doing something wrong, they have circled our hospital in their vehicle and eventually left, because they didn't know what to say to that person inside of our doors. Now, I do not judge those people who have a hard time with these conversations, because they are hard conversations. But let's not overlook that part of what Job's friends did is they actually went together and they were with Job. Next, these men cried aloud. They wept. They let their tears fall. Glenda is with us. Pastor Glenda is on the live online today. She was in an event a couple years ago. I don't remember where exactly what was happening, but I remember starting to cry when I saw a certain story up front, and I apologized. I said, I'm sorry. And she called me out in the middle of it. She said, don't apologize. Don't ever apologize for shedding tears. And I've tried to live by that ever since she gave me that encouragement. But as a white Midwestern male, sort of a type A personality, I avoid crying whenever I can. But there is such power, haven't you found? Thank you, Glenda. Haven't you found there's such power when you're with somebody to let your tears fall too? Matt and I have a mutual friend whose wife died about 2.5 years ago, and he's about our age, she's about our age. And it was tragic. It was sad, small children. I got the call early one morning. My chaplains knew the relationship there. I wasn't on call. I'm on call about 50% of the time for our hospital, but I wasn't on call. Our chaplain called me. The first thing he said, and it was 6 o'clock in the morning, he said, I know you're not on call, but I thought you'd want to know that Amy just died. And so I got dressed and I went over to the hospital. I met my friend in the hallway, went into her room, and I've always told my chaplains, it's okay to shed tears. It's okay to shed tears. Now, we are working as a professional role. We've got a badge on, and so at some point, you can't let it become about your own sadness, because you want to stay focused on the other person and what they're facing. So if you ever become overwhelmed, just simply step outside the room for a while, gather yourself, and go back in. I had never needed to take my own advice until 2.5 years ago. And because of my compassion for my friend, and because of how tragic it was, I started crying so hard that I couldn't sort of get myself together. And so I stepped out of the room into the hallway, and a nurse who was about 12 years old, well, they all look like they're 12 years old and they're looking younger all the time. She came over knowing that, you know, I'm dressed in a suit and a tie. I'm a director of a department of a hospital, the chair of the ethics committee, et cetera, et cetera. And, you know, she comes over probably in her first couple of years of nursing, and she looks at me, she said, "Are you okay?" And word quickly got around that the director of the chaplaincy department was bawling his eyes out on the unit. It's okay. In fact, tears help. So imagine these three men, probably men of affluence like Job, coming in and shedding tears along with him. Fourth, they came in and they actually got down, they sat down on his level. They didn't stand over him. So there's really interesting studies that we're not going to take the time to discuss in detail today that show that when a healthcare provider, like a doctor or a nurse, sits down and has a conversation with us, that we perceive time, we perceive that person differently. And so it's powerful to go in and to sit down. And last but not least, remember what it says at the end. It says, "For 7 days and 7 nights, no one said a word to Job, because they saw how great his suffering was." Just going 7 seconds with silence on a live online might make you check to make sure your connection wasn't lost, or that my image hadn't froze on the screen. It's hard to be silent. There's all sorts of things that come rushing to the surface that we want to hurry to say. And yet what we need sometimes when we sit with them is to just be quiet. Okay, let's talk about God versus doctors. Is coronavirus evil? Type a Y or an N in the chat. Is coronavirus evil? No, okay. Some of us might depend on our experience. We're seeing lots of no's so far. No. Thank you, Paula. Thank you, Jill. Yes and no. Deacon's hedging his bets there, or her bets, to make sure that we're on both sides. Nancy says no. Thank you. So mostly no's. Okay, so let's think about this a little bit, because it is terminology that we use, right? Like, we're going to fight against this evil. We're going to battle against this pandemic. You know, we are governmental leaders using terms like that. Perhaps we've used terms like that as well before. So I want to parallel this to cancer. And so chances are some of you on the call today have experienced cancer yourselves. Certainly many of you have experienced cancer in the lives of someone close to you. And so when we think about cancer, what do we talk about? We talk about the battle, the cancer fight. We talk about how strong the cancer patient is, and they're a warrior, and they're not a quitter, and they're going to fight. They're a fighter, you know, these sorts of things. So I just want us to analyze how we think about it. So fighting coronavirus, fighting cancer or some other illness can be energizing. So when we think about cancer and think about fighting cancer, it can be energizing to eat maybe the things that we're supposed to eat, take the medication we're supposed to take, to battle through chemo, which is such a draining and difficult thing to do, radiation, all the appointments, all the follow-up. And so talking about fighting it can be energizing. And right now, thinking about coronavirus, talking about fighting against it can be energizing. It can energize us to wear a mask, energize us to tolerate long times where we're not together with our congregations. It can energize us to sanitize our hands. I love seeing the kids today. I don't know your experience, but teenagers are getting it in ways maybe adults aren't. And teenagers, we watch football guys walk out in their masks, teens coming out of the school, sanitizing their hands, wearing their masks as they're together. Certainly not 100% perfect, but that idea of we're going to fight for this, or we're going to fight against this, can bring energy. But what if we're talking about fighting cancer, fighting COVID-19, and then somebody dies because of it? If I die because of coronavirus, even though I fought against it, doesn't mean that I lost. We'll even use that terminology. And I'm not trying to tell you to stop talking about fighting cancer or fighting coronavirus, but one thing we've got to stop saying is that someone lost their battle with cancer. We've got to stop saying that, because that portrays them as having done something wrong, maybe not having enough faith or something crazy like that. And we've just got to analyze how we talk about this when we talk about it as a fight or cast it as evil. So Job, we know from the story that it seemed to be Satan that was bringing about everything in his life. And yet Job says, shall we receive good from God and shall we not receive disaster? So to Job, as somebody already said, his disasters seem to come from God. So type a Y in the chat if you've heard any of these things or a version of any of these sayings. The doctors gave up on him, but I know God's going to heal him. She's in a hospice, but people all over the world are praying for her. The doctor doesn't get the final word. We know only God is sovereign. Have you heard or said things? I've said things like this. Have you heard or said things like these statements? Yeah, heard those. Yes, many of you for those. Thank you, Nancy. Yeah, you've heard things like this. And I want to give us a word of caution, because I think when we set up God and the doctors as in competition with one another, that's a confusing way to communicate to people who are sick. I think we can all be on the same team, can't we? Can't doctors? I haven't met a doctor yet who says, well, I would just never want there to be a miracle of healing in this patient's life. No, even most doctors will talk about, I've witnessed miracles of healing. Patients I thought were going to die that didn't die. Patients I thought weren't going to survive a procedure that did and had a thriving life afterwards. Can't we view ourselves? Now, I'm not saying that there's not doctors that are headaches. I'm not saying there's not times that we've got to have a frank conversation with a care provider and say, this is not where we're at. This is not what we're thinking. Certainly those frank conversations, but to portray the situation as God versus the doctors like they're competing with each other is not a helpful competition. So let's dive a little deeper into leadership during a pandemic and your leadership as a congregational leader. To get there, we're going to go through a couple polls, and the first one we can throw up here and put on the screen for you to respond to. What I'm curious about with this first poll is, what has been your view of visitor restrictions at the hospital? So Matt's going to throw that poll up there for us about visitor restrictions and your feel about how that's been. I'm sure many of you have had to interact a little bit with trying to go to the hospital and not necessarily being able to visit like you normally would, or others. What's your view of the visitor restrictions certainly imposed during the lockdown, but still imposed in many places as well? Do you understand? You don't like it, but you understand. You're frustrated? Are you infuriated by those visitor restrictions? So I'll give you a second to respond and click submit when you've selected your answer. As a person who, I recognize you've got somebody in healthcare on the line, but I just want you to be honest about your feelings about those visitor restrictions. All right, so our response here, we've got a few people that are frustrated. Most of you at one of those top two there, it's difficult, but I understand. A lot of you saying, my largest group saying, I don't like it. Fair enough. I don't really care for it myself. All right, we're going to get to another poll where we're going to take a little step further here. And we're going to think of it from a personal standpoint. So I want you to imagine, some of you won't have to imagine because it's actually happened to you. Imagine that the person closest to you, a spouse, a parent, a child, a good friend, the person closest to you is in the intensive care unit, and they can't talk with you on the phone because of how sick they are. And there's somebody at the front entrance telling you you can't come into that place where your loved one is. If you can imagine yourself in that place, what's your view now? So click the response that's appropriate. We have the same set of responses here that were available for the last one. I'll give you just a moment to respond to this poll. Be sure to click that submit button after you've selected the one that matches your feeling. Okay. Matt, we have lots of honest people on the live online today. I love that you, as you imagine yourself in that position, We had 0% infuriated the first time around, and now we're at 65% of you saying that you are infuriated by this. What you know, and that I'm going to remind you of now, is that many people in your congregations have not had to imagine this. They have lived this experience. They have been that person who's on the outside of a facility, either looking through a window, maybe if it's a nursing home facility, that's still very much happening right now, or trying to call in to a nurse's station where they could get an update, maybe trying to FaceTime their loved one, even if their loved one's not able to respond much. So Matt, we could take those results down. I'm gonna check our chat here real quick. And so we want to obviously have compassion for those that have experienced this. So I talked earlier about my role as the chairperson of the ethics committee for Parkview, and I'm going to talk ethics for just a minute so you can see where this comes into conflict. So I've taught ethics for the past several years at Parkview to new nurses and chaplains and others. And one of the things I talk about is 4 pillars of ethics. The 4th pillar of medical ethics is something called contextual features. I won't go through all the others, but the other 3 all have to do with the patient individually, their wishes, their background, preferences, the indications that they have medically. The 4th pillar is about contextual features, which is everything else. So the things that don't have to do with the patient. What's the context around the patient? What's the family situation? What's the hospital situation? What's the financial situation? That sort of thing. So I have, for years, when I've talked about this 4th pillar, I've said, you know, the contextual features seldom come into conflict with the personal needs of the patient. Private rights, that's how I want to cast these 2. Private rights, so my right to have my loved one there when I'm at the hospital, my right to decide for myself what's going to happen for me in my care, etc. Those and public health interests, I have always said, seldom come into conflict. Well, the pandemic, in the words of the meme, has said, hold my beer. So watch me take private rights and public health and smash them into conflict with each other. And so I want to reframe some of what you've been experiencing, even if you're not in a healthcare setting. You've been experiencing public health concerns and private rights smashing into each other in a way that they've not been in conflict before. All right, we're going to do a couple more polls and get at some thoughts that you have. So let's go ahead and throw that next poll up here. We're going to ask you about your level of trust for governmental leaders. And this poll that Matt's going to put up for us is going to focus on local and state governmental leaders. So we're not looking necessarily like global or national, federal level, but your local and state governmental leaders. Would you say that this year has increased your trust in them or decreased your trust in our local leaders? So I'll give you a minute to read through the options there to pick which one of those reflects your view of how 2020 has impacted your trust of our governmental leaders in your town, your county, and the state of Indiana. And once we've got some responses, we'll get to see those replies and how you've voted for this one. Don't forget to click the submit button at the bottom after you've made your selection. So most of you are in they've handled it as well as possible. No one trusts them now more than ever, fair enough. And then a good number of you on those bottom 2 there where you've lost some trust in our leaders or have significant questions. All right, we're gonna move on to another poll that's gonna be a similar feel, but it's gonna zero in our healthcare leaders. So county health commissioners, our state health commissioners, local leaders of nursing homes, leaders of hospitals. Would you say that 2020 has increased or decreased your trust in healthcare leaders? So across the spectrum, from the person leading the nursing home where you have a family member to national healthcare leaders, would you say that this year has increased or decreased your trust in healthcare leaders? And it's okay to, as you've been, continue to just be completely honest. pretty similar results to governmental leaders. So a lot of you saying I've done the best job possible, and others have questions about our leadership. So thank you. I think that's going to lead us into some other things that I want to talk about with you. There is some angst towards leaders right now. So these are things that have happened and are happening when the chaplain, so I'm putting in my role, when the chaplain lobbies for visitor restrictions at the hospital, normally we're the ones calling you in the middle of the night if your loved one was in a car accident or had a heart attack. We're the ones waking you up. Sometimes we're even sending police to your house to knock on your door or wake you up and say, this is what's happened. Can you come to the hospital? During the pandemic, we've been the ones on that same phone call saying, this is what's happened. You can't come to the hospital. Well, that goes against something inside of us, just like the second one on this list goes against something inside of congregational leaders. So congregational leaders who have said everyone needs to stay home and not come to our services on Sunday or Saturday or Friday. Please don't come to those. Imagine, could we have imagined this time last year, a scenario in which a pastor, a priest, a minister, an imam, a rabbi, where these congregational leaders, a church board making a decision to say we're going to close our campuses for this time. Unprecedented, going against what is in the nature of a pastor or any other congregational leader. Imagine governmental leaders shutting down the economy. Imagine athletic directors shutting down sports events. Everything just feels upside down. I'm just going to pause and I'm going to say that last phrase again, and I want you to put a Y in the chat if you feel this way too, that the world feels upside down. We have a chaplain lobbying against visitors coming, pastors and congregational leaders asking people not to come, and inside out. Yeah, it's another good way to say it. And government, no government official who wants to get reelected ever tries to harm the economy, right? So all these things feel inside out and upside down. I'm going to say two things, very much so. Thanks, Joan. Two things here. And I had to take some of my own medicine. I was telling Matt and Unita before we got on the phone. I had to take some of my own medicine here. So I have done this and walked this myself. If you have unduly criticized a leader for doing the best they can, you need to apologize. Now, I'm not talking about pointing out where someone is just plain wrong and taking an opposite position of them. But I'm talking about dragging somebody's name under the bus. I'm talking about railing against them or questioning their character or just downright being mean. Posting things on social media that call into question that superintendent or that bishop or that leader. If you've unduly criticized someone during this time, you need to say you're sorry. So I'm just going to hover there for a moment. If there's conviction that you need to feel, go ahead and feel it, because I'm going to give you some grace next. But right now, feel that conviction. On the other hand, if you have been that leader that has been attacked, some of you could tell stories right now, and probably better that you don't in the chat at the moment, but you could say, this is what this church person said to me, or this is what this church leader even said to me, or this is what was posted on our Facebook page or our social media. If you have been torn to shreds, and sometimes it only takes one sentence to tear a big-hearted congregational leader to shreds, right? So it doesn't even have to be just a total thrashing. One simple thing sometimes can be what lives with us. An author that I love calls that death by paper cuts. When you experience all these little barbs and words. So if you're that person, let me just stare right in your eyes right now and say, you need to give yourself some grace. And I'm going to give you something to do and say on this next slide that is going to help you give yourself some grace. Are you ready? We're going to say this together. So look at the phrase on the right. And I actually don't want you to repeat after me, even though that's what I have on the slide. I want you to say it with me. We're going to say it together on three. Ready? 1, 2, 3. We did the best we could with the information we had at the time. Okay. All right. Now we're going to say it like we mean it this time. So get some tension out of your shoulders. Say this with your whole heart, giving yourself some grace, because you have likely had to say something, do something, make some decision during this time that perhaps you have received some criticism, either outward criticism of people actually saying it to you, or internal dialogue that has been beating you up. Yes. So Art's echoing this. We're going to say this together one more time. Ready? 1, 2, 3. We did the best we could with the information we had at the time. And then take a deep breath. If that's something you need today, I just want you to hold that close to your heart and to live with that today. About a month ago, I was listening to a podcast from the American Medical Association Journal of Ethics. So this is a highly regarded national association talking about how we ought to handle the pandemic. I listened to it about a month ago, but it had been released at the end of March. And so at the end of March, the world was not the same place as it was in the middle of July, was it? So as an ethics leader, I'm listening to other ethics leaders, national ethics leaders, talk about the pandemic and how it should be handled. And boy, they were wrong. Because the information was old at that point, right? We'd lived so much, we'd seen so much more since that time, and it was easy. It would have been easy for me to be like, listen to these guys, what jokers, they don't really know what they're talking about. How'd they get on this podcast? Well, you know what? They were doing the best they could with the information they had at the time. One of our chaplains said at the beginning of everything, if we do things right as a healthcare system, at the end, people will say that we overreacted. Let me say that again, because you might need that one too. If we do everything right, at the end, people will say we overreacted, because we need to put people's health and safety first, and churches and congregations have been doing that in ways they never have before. Okay, so I believe that all of our congregations that are online today are ones which would celebrate Easter in one way or another. So how is Easter? So put one word in the chat. This year in 2020, of course, a lot of churches not having in-person services. How was Easter this year for you? Quiet, powerful, as good as it could be. Good attitude about that. Depressing, subtly joyful. I like that. Heartbreaking, weird, unsatisfying, disappointing, silent. We got a couple of silence and quiet. Meaningful, good. Empty and sad. Yeah, we're kind of unusual. Yeah, I think that we could probably all use that one to some extent. There's some unusual things about it. Sad, tomb-like. A new understanding of the dark of Good Friday. Yeah, sometimes we really rush past Good Friday to Easter, right? But not so much this year. Sad and different, really different. Unusual. A lot of you communicating that things were different for sure this year. So let's think through Easter just a little bit. So Jesus, after the resurrection, you remember the story. Mary comes to the tomb. She sees Jesus. She holds on to him. She holds on to him for so long. God bless her heart. I love this, that Jesus finally has to say, you're going to have to let go. She's holding on and clinging so tightly. And then remember, Jesus appears to the disciples. Thomas has to touch his hands. Jesus actually breathes on them in the upper room, says, receive my spirit. They're in this locked, sort of cloistered, small space all together, probably not social distancing. Breakfast on the beach, so they're eating out together. And then there's large group gatherings going forward to the day of Pentecost and beyond. And travel. We know the road to Emmaus, and again, the day of Pentecost, lots of travel involved. So let's think about the presence that Easter usually typifies. The presence that even the Easter story communicates. And then in year 2020, to parallel or juxtaposition what we experienced this year we got the message, don't hug people, don't touch people's hands, Thomas, that's crazy. Jesus, why are you breathing on all of these people? Certainly don't meet in a small, tight conference room. I had to review a computer-based learning module at Parkview today telling us not to sit close to each other in our lunchrooms. That's true. That's something that we're teaching and we're talking about right now. Jesus met with them in this tiny little space, breathing on them. Certainly don't eat out together was the rule for quite some time. It's somewhat changing now. And don't travel unless absolutely necessary. So the juxtaposition there is what I want to point out. Why this feels so unusual is because Easter should be, and normally is, a time of togetherness, of solidarity, of presence. And this year we were newly experiencing quite a lot of isolation. Isolation, we know, is toxic. That's why so many people would say solitary confinement in our prison system should be done away with forever, because isolation is such a toxic thing to experience. I'd like for you to put a yes or no in the chat if you're aware of a secondary death from coronavirus. What I mean by a secondary death is someone who didn't die because they had COVID, but they died because of a ripple effect of what has happened. So in a couple straightforward examples, someone who struggles with depression, maybe not able to access their normal services, and dying by suicide. Incidentally, if you're still saying committed suicide, I encourage you to change your words to died by suicide. So that could be a secondary death. They didn't necessarily have COVID or weren't necessarily exposed to it. Another example might be someone who, a congestive heart failure patient, or maybe like we talked about, the knee replacement patient, who weren't able to access the normal services, and something perpetuated there that they died from that. A surprising number of yeses coming through. Certainly not all of you by any stretch, thank God. But quite a few of you saying yes, that you have, that you're aware of. Maybe it's not someone that's close to you, but you're aware of a secondary death. So coming out of isolation. So we know that Sunday morning, if that's when your congregation gathers, that's an important time, but it's not the only important thing. It's also important to have these pastoral visits, right? Smaller groups, grief support groups, individual times together. And so what I want to encourage you to do, and I'm going to ask you to do something on a pen and paper, with a pen and paper, pencil and paper, or a note in your phone here in just a second. So make sure you got something at the ready. I want to encourage you to check on people that might fit into one of the under one of these umbrellas. People who have mental illness, the elderly who may have had increased isolation even over and above what everyone else has. Those who are grieving. So think about people who maybe had a death in their family or their life in November or January. And so they were already in grief before they got to this point. We're going to talk about special griefs during COVID in just a minute, but think about people who are already grieving, people who have struggled with addiction in their lives. And then last but not least, people are just trying to hold a lot of stuff together. So I want to give you a second with those umbrellas. And what I want to ask you to do is to think of someone that might fit under one of those umbrellas in your life who you have not yet checked in on, or you haven't checked in on them what feels like recently to you. Do you know someone with mental illness, an elderly person, someone who is already in grief coming into this, who struggles with addiction? They're just trying to hold a lot together. When you think of that person, maybe it's 2 or 3 people, but make sure it's one at least. I want you to write their name down. Don't put it in the chat. That's not what we're looking for. But write their name down on a piece of paper, record it in your phone, somehow record the name of that person that comes to mind for you, who might fit under one of these 5 umbrellas, that you as a pastoral presence, you need to check on them. Whether that's a phone call, video chat, or going and actually seeing them in person. We're going to talk about that in just a second. Okay, once you've gotten that person down, just put a Y in the chat to let me know that you've recorded a name, you've written it down, you've put it in your phone someplace. Thank you, Julia and Sharon. Yeah, thank you, Art and Deb, Laura. Just think of all the people that are going to be touched by these contacts. Alicia and Jill, Paula, Bill, thank you, Joan. You know, these are things that a lot of you would do anyhow. So this is just a prompt for you to do that. Okay, so let me share just briefly personally again. I am an introvert, so I love the jokes at the beginning of quarantine. I said introverts have been preparing for this their whole lives, not going out in public, not talking to people, you know, that sort of thing. And so for me, my work, I still needed to be there. I was talking to people more than ever. But in general, I'm not a person who needs a lot of people contact. However, there's been a few times during this difficult season where I've gotten an email, text, Facebook message from somebody at just the right time, and it has changed my experience of what I've been going through. So I had a man who's about my age who I don't know Nate very well, but he knows what we do at the hospital. He has a daughter who's interested in maybe doing something like hospital chaplaincy sometimes. So we've talked a lot about what we do. And in the middle of one of the most difficult weeks, I got a Facebook message from Nate, and the whole message was just a prayer for me, for my chaplains. Maybe that's what someone in your life needs right now. I ran into Nate when we went grocery shopping a few weeks later, and I'm not much of a hugger, even when social distancing isn't a thing, but I wanted to hug Nate, even though we were both in a mask and at the grocery store and all of that. I didn't, but I did want to, because of what it meant to me to get a message like that, a prayer like that during that time. Okay, now I'm going to go from preaching to meddling here. Is it time to get back together? So yes or no, put your opinion. I'm not going to qualify it in any way. Yes or no, is it time to get back together? We've got a few no's starting off. No, no, no. A lot of no's, a lot of no's. We've got a few yeses now coming in. The yeses are raising their hands. Yeah, it's time to get back together. Yeah, Nancy's hedging her bets. Yes, saying no. Good. Already are. Yeah, many of you are already, of course, holding your weekly services in one way or another, maybe modified, but many of you, I would say probably most, at least, congregations are meeting together again at this point. So I'm going to answer a little bit like Nancy and say yes and no. I do think it's time, where it doesn't present an imminent risk, to get together with the people who've had a lot of these layers that we talked about earlier. It's time to go, maybe even to wrap your arms around them, to sit with them, to be quiet, to cry with them, to listen to what they have to say, to let them tell you about the pains in their hearts. If it's somebody who's at risk, or you've been exposed to COVID lately and you don't want to expose others, then please, of course, take those precautions. I'm not unilaterally advocating that you go with the people that are hurting the most, but I think it's time for us to do some of that if we're not already. I do think the day of Pentecost can wait a little longer. Remember the day of Pentecost, a huge crowd, and people from all walks of life and from all sorts of different places. This is right now, this article that's linked here, and you'll get these slides, but this article that's linked here from, I think, the magazine Scientific American, talks about what all of us are seeing now is that the events where there's lots of people, especially lots of people from lots of different walks of life, maybe traveling and coming to a wedding or an event or something like that. What they're calling these super spreading events. And so this is the sort of environment that is propelling the rates of positivity for COVID forward still. So, so that's why I think things like the day of Pentecost, where we get a lot of people in one space from a lot of different areas, lots of different families, homes, parts of town, regions, workplaces, getting them all together in one place is still something that we should wait on a little longer. We need to give our schools a chance to finish out the semester. We need to give our hospitals the opportunity to respond on a more moment-by-moment basis instead of being inundated. So that's, you tuned into a live online that I'm giving my opinion. So that's my opinion. I think it's time to be present with those who are really suffering, unless there's some other extenuating circumstances. But I do think those big gatherings with people from lots of different places where social distancing really isn't a possibility are events that can wait a little longer. Okay. I'm not going to ask for questions or follow-ups on that one because we could probably stay on that topic all day. But let's talk about special griefs, things that may have happened during this time. So let's say since the 1st of March or so, that are special griefs that people are experiencing. So I'm going to share a book at the end that my wife and I actually finished during quarantine. Well, we released it during quarantine. It's finished a little bit ahead of that, about miscarriage and stillbirth. And so we're very invested in that. My wife, Kristen, is involved in that a lot. And the experience of moms having miscarriage or stillbirth during coronavirus, where visitation to the hospital has been so limited, is an especially difficult thing. So she had a support group, Kristen had a support group last week, and she had 3 moms there who had stillbirths during, since the pandemic hit. And she asked them how many of them were alone, like didn't have family or friends with them when they found out their baby had died. All 3 of those 3 new members of the support group said that they had been alone. The news that your baby has died is hard enough to deal with if your partner or spouse or best friend is there at your elbow, but it's amplified during this time if you're wearing a mask and you're alone. Obviously, anybody who's actually died with COVID, and incidentally, that's how I talk about it. I don't talk about dying from COVID because it's always a complicated mix, but we can know when people die and they had COVID when they died. So people who died with COVID, that's a special grief. Suicide is always a special grief because it's taboo. We don't like to talk about suicide. Again, encourage you to use the phrase died by suicide, not committed suicide. It decriminalizes the idea of suicide. So a person who's died by suicide it's usually a taboo thing to talk about with those that are left behind. And this time has only amplified that. Similarly with victims of violence. It's hard to know what to say to someone who has a loved one who's died as a victim of violence, but we need to initiate those conversations. And those situations are amplified because of the isolation. And then isolated deaths of any kind. I can't tell you how many times people have died in our hospital without the same number of people around their bedside that they normally would have. So those isolated deaths that have happened basically since about March 13th going forward. Even today, this is still happening. So somebody who dies in our hospital today can have visitors at the end of life, but up to that time when they die, they can only have 1 visitor. And so those are isolated times. So how to help? If there's somebody in your life who's experienced miscarriage or stillbirth, this book that Kristen and I released in April will help them. It will help them not feel so alone. It's going to share with them several women's stories, a couple stories about things they experience kind of across the spectrum of the experience of loss with miscarriage or stillbirth, but it's also going to go real practically into some of the things that you can do, some of the experiences that people have as well. So I do believe it's a book that will help. I'm very proud of what Kristen and I put together. And if you have someone in your life, whether they experienced it during the pandemic or 20 years ago, we've had a lot of moms who have read it who've said this helped me, even though my miscarriage may have been 20 years ago. Okay, I know it's a little small, but let's talk about some other practical things. I'm going to take a breath because I feel like I'm talking too fast. Okay, just to mess with those of you who read slides ahead like me, I'm going to start from the bottom up. One thing that you can do as a congregational leader is to schedule a memorial service right now. So I have a conversation probably later today or tomorrow with a pastor in the area who they just had a lot of deaths in the past month. And so they're going to have a group memorial service for anybody in their congregation who has had somebody who's died during this time. I do that. I don't know how much more direct it can be. You should do that. Blue Christmas service. Some of you have had Blue Christmas services before. That'd be a good time of year. We're planning from the hospital side. In the middle of November, we're going to have an online memorial service. We're not calling it a virtual memorial service because it's a real memorial service where we will invite 1,800 people who have had loved ones who have died at Parkview over the past several months to join us for an online memorial service. This is something you can do with your congregation to say their names, to remember those people purposefully. Don't say, I'm here if you need me. I have said this, so I am talking to myself, I'm talking to you. Don't say, if you need anything, just let me know. Oh, great. My spouse just died, and now I have to carry all that grief, and I have to let you know how to help me carry all that grief. So what could you say instead of, let me know if you need anything? You could say, hey, I'm going to stop by next week with dinner. Do you have any dietary restrictions or any nights of the week that won't work? And so you're not asking them, tell me how to help you. You're saying, I want to do this. Tell me a way that, to help me make sure that I'm actually helping. You could say, hey, I'm going to come over the rest of the summer and mow your grass. And if you want to talk, I'll be out there. If you don't, you can just stay inside. You could say, hey, next Tuesday at 6 p.m., I'm going to give you a phone call and I'm going to just ask how you're doing. And then you can talk for as long or as short as you want. If you don't want to talk, just don't answer the phone. So these are things you could say instead of let me know if you need anything. Next, mark down the anniversary of that person's death. So when you thought through people who have had losses, mark down that anniversary, put it in your phone, put it on an annual recurrence reminder. And that way next year, when that time comes around, I guarantee that person will be thinking about the person who died. So when you communicate, hey, I realize that next Tuesday is when Susie died, you're not bringing it up. They're already thinking about it. You're honoring and speaking out loud the fact that they're already thinking about it. Send an honest card, way too many cards, say thoughts and prayers, promises, blah, 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 everything's going to be okay. Don't send those cards. Find a card that's honest or write your own that says, man, this stinks. And I don't know what to say, but I feel that too. Say their names out loud. Of course, this is important with what we've been hearing about some of the racial injustice. This is important just in general too for anybody who dies. So my wife and I experienced miscarriage early on in our marriage, and that baby's name was Stephen. And so when people talk about that miscarriage, instead of saying the baby you lost, if they say Stephen, that's a blessing to us. There's not a lot. Our other 4 kids that are living with us, we say their names all the time. Daniel, stop doing that. Hey, Levi, come on over here. Hey, Kelsey, how are you doing? We say their names all the time, but Stephen's name is not spoken very much at all. So if you have a friend whose Uncle Tom died, ask him, how are you doing since Tom died? Instead of since that happened or your uncle died. Ask about their hopes, not just about how the person died, but about their life ahead of time or that they missed out on as well. I heard an interesting thing on a podcast this week, a podcast that's actually also underwritten by the Lilly Endowment. So this will sound maybe like a Lilly Endowment commercial for a moment here as we're on a Center for Congregations Live Online. But the Kate Bowler podcast, Everything Happens, highly, highly recommend it. Type a warning in the chat if you've ever listened to Kate Bowler's podcast or read her book, Everything Happens for a Reason, and Other Lies I've Loved. That's the full title of her book. Love that book. One of my favorites. On Kate Bowler's podcast last week, and it's spelled just like it sounds, Bowler. Wrote a Bible study using this. Fantastic. That's awesome, Julie. I'd love to see that if you don't mind sharing that. So she had a guest on last week who said, you can grieve something that you never had. I thought, that's not the way I've described grief is the feeling you have when you've lost something. But he said, you can grieve the loss of something you never had. So going back to Matt and I's mutual friend, he can grieve the fact that his wife won't see his kids go off to school this fall. That's something that he didn't have, but he can grieve that he's lost that. He never had, his wife there when they graduate from high school, but he can grieve that he's lost that. So not just about what happened grief is the loss of the future story. That's a good way to say it, Julie. So all the futures that you imagine, or even if you didn't imagine it, you just assumed it would happen, if that person's gone, all of those things are gone as well. Not just the absence of the person and the grief over their death, but also the absence of them in the future as well. So we talked about planning a memorial service or doing funerals. I want to recommend this book by a friend of mine named Dr. Jon Swanson. John's also a consultant for the Center for Congregations. This is a fantastic, I've used this resource in preparing for a funeral, even though I've done plenty of those things in the past. I had one come up recently for somebody I didn't really know. And so I pulled this up and used it. It will give you templates. Many of us have a minister's manual that may be bound in leather with gold trim on our shelves. Many of those that tell us how to do weddings and funerals and baptisms and things like that, many of those, of course, were written in the 1950s or 60s, and they're fantastic, and I still use them. But this is a more recent resource, something that was released actually during the pandemic, and so I encourage you to pick up a copy of that as well. All right, let's get personal, as though we haven't already, right? So let's talk about moral injury. Let me check my time, make sure I'm not gabbing on for too long. Okay, we've got time for this. So moral injury is when we do something, observe something, or we fail to prevent something from happening that goes against our deeply held beliefs. So we say that again. It's when we do something, when we perpetuate something, when we fail to stop something from happening, or when we just watch something happen that's against our deeply held beliefs. That hurts us in a very internal, down deep in our souls sort of way. So again, the pastor is saying, let's not have church, so to speak. Excuse me. The government leader shutting things down, the person who wants to connect with a grief support group canceling the in-person meetings. These are things that go against our values. This can lead to PTSD, post-traumatic stress disorder. And so there's a link included here at the bottom. When you get these slides, click on that link for a VA article about moral injury and about post-traumatic stress disorder. And it's something that many of us are facing. The answer is forgiveness. I don't know if you've noticed this. Lots of congregational leaders are great at promoting forgiveness of others. You know what I'm going to say next. And not great at accepting forgiveness for themselves. After I have done something, witnessed something, or failed to prevent something that goes against my morals, can I forgive myself? Does God still love me? Can I let myself off the hook because I did the best I could with the information I had at the time? So be aware of this moral injury for yourself and for others, and read that article. Okay, some concluding thoughts here, and then we'll open it up for any Q&A that we've got at the end. I do want you to be present when appropriate. It's not appropriate for everybody, but for sometimes now it is appropriate for you to be present. I do regret to inform you that as a pastoral person, you can't visit our hospitals right now. We're still not allowing that. But there are other places that you can be. And if it gets to the person's end of life, there are often considerations that are made or allowances that are given at the end of life that may not have been in place up to that point in time. Remember that we all experience all these different layers. So there's more Jobs now than there's ever been. One of our chaplains I spoke with earlier today, he had his mother die with coronavirus during this time. His grandfather died with coronavirus during this time. He had to perform his mother's funeral via video. That sucks. Sorry for my language. That sucks. Not being able to physically be present after some time spent with his family. He had to quarantine when he came back home, which meant he couldn't come to work for a while. Then he followed up with some other losses in his life and eventually some personal health issues that he was facing. I joked with Chaplain Will, who's one of my favorite guys ever. I joked with him that Job was looking down from heaven and saying, "Dang, Will, that's a lot of stuff to deal with." He didn't think he was quite to the level of Job yet, but there are more people having Job-like experiences now than ever before. Schedule a memorial service. Put something on the calendar now. When we scheduled our November memorial service for the hospital, we had to accept that we weren't exactly sure how we were going to pull it off. We just know somehow we're going to have it online and somehow we're going to do it and somehow we're going to honor all these people who have died. So even if you don't know exactly how you're going to pull it off, schedule it for the holidays, a month out, 2 months out, and put something on the calendar now. Call those most affected. Remember those 5 umbrellas that we talked about, those with mental illness or past addiction or grief coming into it, the elderly. Reach out to even just people who have a lot going on. They're trying to get their hands around. Reach out to them. Give them a call. Be careful who you or what you cast as evil. When we think about this pandemic, we think about different leaders voicing into the pandemic. We always need to be careful who we describe as evil because of how we may have to think about that depending on what happens if that person dies later. And last but not least, forgive yourself. Don't just extend that forgiveness to others, but make sure that forgiveness is coming to you yourself as well. All right, well, I will be quiet for a minute here. Matt may be coming back on with us, and happy to answer or reply, I guess is probably a better way to say it, reply to any questions that you may have. Put up some of the topics that we've talked through here on the screen as a reminder of things we talked about. Matt's going to tell you a little bit about the Center for Congregations, and I'm happy to respond to any questions. Go ahead and put those into the chat, and we'll reply to those as well.
Thank you, Patrick. All right. Yeah, if you have questions for Patrick, we definitely have plenty of time left here, so he can jump back on, no problem, and answer any questions. But thank you so much for being a part of this event today. And there's a lot here. And just as with any education event, we know that this event is not the end all be all of learning about these topics. And that's where the center hopefully can be helpful to you through resource consulting and through our resource grants programs, and of course, additional education events. So if you have questions on specifics about today's topic that you want some more depth, to find some articles or books on any of these pieces of subject matter, we can help you find those. We'll play personal research assistant through our resource consulting. And if you needed to purchase a curriculum, bring in a consultant, or find funds to access outside expertise in some way, then a resource grant might be right for you. And those are dollar for dollar matching grants of up to $15,000 to help you access resources. Those grants are non-competitive, which means that everybody on this call, your congregation is eligible. And if you have something that is grant eligible and are willing to do an application, do our application process, odds are you would receive the funding. So the quickest way to find out if a project is grant eligible is just to email or call us, and we can let you know pretty much on the spot or within about 48 hours whether a project is eligible or not. So those are the ways that the center can be helpful. So appreciate everybody's comments in the chat and thanking Patrick. And yeah, absolutely. Thanks for that encouragement, Reverend Walden. Appreciate that. So real quick here. Oh, okay, we have a question. Wow, I can see why you would feel overwhelmed, Sharon. Absolutely. Yeah, Sharon, I'm going to put a poll up here. Patrick, I don't know if you want to speak to that, but I'll also put a poll up here that if you'd like Center for Congregations consultant to reach out to you proactively to talk with you just about ways we can help with resourcing or with a grant or just an introduction to the center, you can click on that and we'll follow up with you. But yeah, Patrick.
Sharon, I'm right there with you. I feel a lot of that as well. Being overwhelmed. For anybody that's an Enneagram person, I'm an Enneagram 1, and that is the reformer that wants to sort of fix the world every day when we get up. I had to admit multiple times that this has been a living hell for somebody who's trying to fix the world all the time, because the world definitely between, as you've said, the weird confluence of the pandemic and racial injustice has felt like the world is maybe more broken than ever. And I feel like I've just been making concessions sometimes instead of actually making improvements, and that kills me. So I feel what you're feeling. Matt and I joked about this earlier before everybody else got on, but in a serious way, I've started to talk to myself a little bit more. As I was leaving the office the other day, our office is on the 4th floor and you exit on the lower level. So I've got quite a few steps that I can go down, and then I go down when I leave. And as I was leaving, before I even realized, I was telling myself, your email's pretty cleaned up. You responded to the people you needed to respond to today. There's no emergency that you haven't tried to deal with in some way, shape, or form. You don't have a lot of things you need to think about when you go home tonight. It's okay that you let yourself off the hook for a little while and enjoy your time with the family. And so I'm doing some of that self-talk, and then just allowing myself to say, this is hard for me because of how I'm wired, how God created me to be somebody who improves things and fixes things, and I can't right now. And so allowing myself to recognize that it's a good thing that God created me that way. That's part of why I'm in a leadership role. But when you're in a leadership role and some of what's innate inside of you is stunted because of the way the world is, it hurts all the more. And so I think, when we had, okay, I'm going to go real specific here, but I'll try to do it quickly. When we had protests, the very first night of protests here in Fort Wayne, they got pretty serious, and the ramifications of those are still being felt today. I went over to the hospital, was with Chaplain Will, who I mentioned earlier, who's experienced so much difficulty. Chaplain Will is a Marine veteran, retired Marine, gunny sergeant who's African-American, he's about the same age as me, has kids about the same age as me. And so I was watching our city kind of look like we're unraveling and being afraid for what's going to happen. and I'm watching alongside, shoulder to shoulder, with a brother of mine who's Black. And I text another friend, some other friends who are African American and who do a lot of good work in our city. And I said, what do we do? What can we do? And Janelle responded, she said, there's nothing you can do. And that is heartbreaking to me, that there are times, that doesn't mean that we stop working, that doesn't mean that we stop doing, but to have some moments where we accept that sometimes there's just nothing that we can do is an okay thing to admit, because that then can become the slingshot for us to then do what we can do later. So for fear of sounding trite after talking about all these deep things, here's a mantra: I can't do everything. I can do something. I can't do everything, but I can do something. And that's one I have to tell myself and remind myself of often. So I didn't really give you an answer. I didn't promise to answer. I promised to respond. So that's my response to sharing. So thank you for that.
Thanks, Patrick, for sharing that. Yeah, in the center, we're doing our best to be responsive to the things that are happening in society. We have a series coming up on racism. We're calling it the Lead and Learn series, The Race to Justice, with Dr. Michael Twyman. That's going to be starting on September 17th. And, there's just a lot happening in that sphere. And so we're going to try to be responsive to that. Hopefully you all have experienced the CRG. And if you haven't, I'll put it in the chat here. But the CRG is a place where we curate some of the best resources that we've found. And we have collections. And so we have collections out there on all kinds of things. And we're hoping to get even more information about race and racism and anti-racism to incorporate there, along with all kinds of other topics. So that is available if you're interested. And actually, I believe that page will launch once, it may have already launched when you join Zoom. It may have opened in your browser. So, oh, great, we're back to full screen. Thanks, Patrick. So just a couple other minor things as we wrap up in our final moments. There will be an evaluation that will launch once we close the meeting down, and we would appreciate your feedback on this session. We're constantly trying to improve our live online education events, and your feedback is really important to us in being able to do that. And we're all, I think there's a lot of fatigue and a lot of feeling overwhelmed right now. So please take me seriously on reaching out to the center for help. And that's not a self-serving thing, I promise. We're here to serve you, and that's the only reason we exist. And we genuinely want to be a support for you during all of what's happening now and out into the future. So I'll put my email in the chat if you want to email me directly for anything at all. You can also just find our information on the website for local offices. Again, Evansville, Crown Point, Seymour, and Indianapolis and Fort Wayne are offices, so you can reach out to your closest office. So with that, we're right at 3 p.m. So thank you so much, Patrick. Thanks, Unita, for running things behind the scenes. And thanks, everyone, for being here. And we'll close the room in just a minute. If you have other questions, you can feel free to ask those. And we'll stick around for a couple moments, but I'll go ahead and go off voice and camera. Play some music to take us out, and if you have questions, we will answer those as we go. So thanks for being here.